Good day everyone, this is Teacher Nori and in this video we are going to learn about the menstrual cycle. What is menstruation? Menstruation is the process in a woman's body where she is discharging blood and other materials from the lining of the uterus at intervals of about 1 lunar month or 28 days from puberty until menopause, except during pregnancy. What is menarche? Menarche is the term used to describe the first occurrence of menstruation. The age of menarche usually begins between 9 to 15, about 2 years after the start of puberty. The average age of menarche is 12 to 13. What is menopause? Menopause is defined as the point in time when menstrual cycles permanently cease due to the natural depletion of egg cells in the ovaries. This occurs when a woman misses her menstruation for 12 consecutive months. What is menstrual cycle? Menstrual cycle is complex and controlled by many different glands and the hormones that these glands produce. There are 4 phases of the menstrual cycle. The first one is menstruation, which goes for about 5 to 7 days. The next one is the follicular phase, which runs from the first day of menstruation to ovulation and lasts for about 16 days. Next up is ovulation, which happens around 2 weeks before menstruation or the middle of the cycle. And the last one is the luteal phase, with an average length of 14 days after ovulation. Menstrual cycle is the way of a woman's body to prepare for possible pregnancy. What happens in the 28-day cycle? On day 1, which is the first day of menstruation, the blood and tissue lining the uterus break down and leave the body. Estrogen and progesterone levels are low, which can make you feel depressed or irritable. On days 1 to 5, as you menstruate, fluid-filled pockets called follicles develop on the ovaries. Each follicle contains an egg. Days 5 to 8. Between days 5 and 7, one follicle continues to grow while others stop growing and are absorbed back into the ovary. Estrogen levels are rising. By day 8, the follicle puts out increasing levels of estrogen and grows larger. Higher estrogen levels from the follicle make the lining of the uterus grow and thicken. Estrogen helps boost endorphins, which are the feel-good hormones, and can make you feel energized and relaxed or calm. Day 14. A few days before day 14, the estrogen levels peak and there is a sharp rise in the level of luteinizing hormone, or LH. LH causes the mature follicle to burst and release an egg from the ovary. This is called ovulation. Around this time, a woman is most likely to get pregnant. An egg lives for 12 to 24 hours only. During the days when estrogen levels are at its highest, a woman may feel best, emotionally and physically. Days 15 to 24. During this week, the fallopian tubes help the newly released egg travel away from the ovary toward the uterus. The ruptured follicle on the ovary makes more of the hormone progesterone, which also helps the uterine lining thicken even more. If a sperm joins with the egg in the fallopian tube, which is called fertilization, the fertilized egg will continue down the fallopian tube and attach to the lining of the uterus. Days 24 to 28. If the egg is not fertilized, it breaks apart. Around day 24, the estrogen and progesterone levels drop. If you are not pregnant, this rapid change in levels of estrogen and progesterone can cause mood swings. Some women are more sensitive to these changing hormone levels than others. Some women feel irritable, anxious, or depressed during the premenstrual week. In this video, we have learned about the menstrual cycle. Learning about the menstrual cycle is important in the reproduction of humans. Until next time!